Okay, so now let's talk about intramuscular injections and subcutaneous injections. Where do you give them? So when we're giving IM injections, we want to be sure that we're giving them in the muscle correctly. You don't want to give it willy-nilly, and there are certain things that you have to look for, and that's your body's landmarks in order to give them right. Usually when I ask the students, how many of you have had a nurse palpate for the bony landmarks and do an injection that way? And normally 99% of the class says, I've never had the nurse feel for a landmark. And just opposite for me, I always feel for the landmarks. So be sure that you're doing that. You want to give them in the correct muscle. How many times have you gotten a shot way up in the top of your hip? Most everyone has, but we're going to find out today that's not where you give a shot. So there are certain landmarks that we're going to do. And I'm going to tell you about one that will never be an answer on the state board, but I want to tell you about it anyways because they don't recommend that I even teach the dorsogluteal. But you will see people give it this way so many times, and I just want to be sure that you know the right landmarks. But this will never be an answer on the test, the dorsogluteal. So the four we're going to focus on is the deltoid, the ventrogluteal, the vastus lateralis, and the rectus femoris. These are the muscles that you will normally give IM injections in. Of course, your deltoid is here. Your rectus femoris is down the front of your thigh over your femur. Vastus lateralis is to the side of the thigh, and the ventrogluteal is here on the side of the hip. So, and the dorsogluteal is in the buttocks in the back. But again, I'm just showing you this because so many people get shots there, and I want to be sure that you know exactly where it is, or in case you get one in the wrong spot yourself. So the four that we're talking about, we have to talk about the maximum dose. Depending on, this is for an actual adult, you can only give 1 cc or 1 ml in the deltoid. On the other sides, you can give up to 3 cc's in that area. So let's say that you do the math and your patient requires a Rocephin shot that has 5 mLs in it. You cannot draw it up and give 5 mLs in one spot. You have to divide it. So you would have to put 2.5 in one and 2.5 in the other, or 3 and 2, and give 2 injections instead of 1. So in the deltoid, it is safe to give up to 1 ml in your deltoid. The other sites, you can give up to 3. Now let's talk about the location. So first we're going to talk about the deltoid, or deltoid. Some are more defined than mine, but there are certain bony prominences that you need to feel for. And the number one is the acromion process. And if you feel, and practice this on your family members at home, if you feel across the top of your deltoid, you will feel a bone, and that is your acromion process. Let's look here on our lovely mannequin. So right through here is what you're feeling for, is that bone. Also, they consider the clavicle a landmark. So if you feel the acromion process up to the front, sometimes you may be able to feel that, or the front of the clavicle. A lot of times you're feeling just the ridge of that humerus, but you're going to feel for your acromion process. When you find your acromion process in your clavicle, you can lay your fingers down, and it's 3 below it, 3 finger breaths below it. Or, and we'll show you on a mannequin in a minute, or you can also find the 2 bony areas, make a V with your finger, and put it in between your fingers. You see, it's really the same. 3 finger breaths, it's about the same spot. When I'm doing a deltoid injection, I don't want the patient's arm to be out here like they're leaning toward me. I have them put their arm down at a 90-degree angle like this. That way their muscle is more likely to kind of pop out. So if I'm feeling for this, because you want the shot to go into the belly of the muscle. And it's hard to show on myself, so I'm going to feel 3 finger breaths, then it would go right there. Okay? Next, let's talk about the ventrogluteal. The ventrogluteal, we're going to feel for the anterior superior iliac crest. We're going to feel for the greater trochanter, which is the top of your femur. And we're going to feel for the reach back with one of our fingers for the iliac crest. To me, this is the hardest one to do. And A good rule of thumb is if I'm going to give it in the patient's left hip, then I'm going to use my right hand to measure. If I'm going to give it in their right hip, I'm going to use my left hand to measure. So let's look at our mannequin here. So here's my greater trochanter. I'm going to put the palm of my hand, excuse me, sir, can you move your arm? Okay, it won't stay. Thank you, Sydney. I'm going to put the palm of my hand on the greater trochanter. With my index finger, I'm going to reach forward for the anterior superior iliac crest. I'm going to reach back as far as I can with my middle finger, and then it's going to go right there. Hard to see on my skeleton with no muscles, but this way I want you to see the bony landmarks. Your greater trochanter, the anterior superior iliac crest, then you reach back with your middle finger and you go in between and make a V. I'll show you on the mannequin in a minute. I really can't show this one on myself. Then you've got the vastus lateralis. These are used a lot. Your leg muscles are usually big muscles. Your vastus lateralis is to the side of the thigh, hence laterally. You're going to feel for the greater trochanter and then the lateral portion of the knee. So this is pretty simple. You're going to feel it on the side, the top of the thigh, or your greater trochanter, the side of the knee. Then you're going to draw your hands in, and where your thumbs meet is where you're going, in the middle is where you're going to get it. For the rectus femoris, you do the exact same thing on the top of the thigh. You're going to feel for the top of the knee, the patella, and the top of the thigh, and you're going to just bring your hands together on the top of the thigh, and where your fingers meet in the middle is where you're going to get it on the thigh. This is really the easiest place for someone if you're teaching to give their own selves an injection. Like if you're teaching someone to give their depot shot or a B12 injection, giving it in the tops of the thigh or the thighs of the side. Sides of the thigh are usually the easiest places to give. Now for sub-Q sites, if we're giving something subcutaneous, then we want to go in the fatty tissue, whereas IM has to go in a muscle. If we're giving medications that are meant to go in a muscle and they are going in a sub-Q site, then that could cause damage to the tissue, and it also slows the rate because medications given in a muscle is going to act more rapidly and it's going to react slower in the subcutaneous tissue. So you've got to be sure you're getting it in the right spot. For sub-Q sites, you're looking for fatty areas. The backs of the arms, the abdomen, the tops of the thighs, even in parts of the back. But it's got to be in the sub-Q tissue. It's also very important that you rotate all of these areas. If you've got someone getting 2 antibiotic IM shots a day, you can't just give them all in the sides of the top of the thigh. You have to rotate it, right leg, left deltoid, right deltoid if you can, the ventrogluteals, and you want to be sure that you are rotating because it can cause damage to the tissue, it can cause abscesses, it can cause tissue atrophy. I know a lot of patients that take insulin want to always give their insulin in one spot of the abdomen. Now mind you, the abdomen is the best place because that's usually where your most sub-Q tissue is, but you need to teach the patient to rotate the sides. Also something about sub-Q while I'm mentioning it, that heparin injections or Lovenox injections, any type of blood thinning injection, is always given in the abdomen unless otherwise directed by the physician. You don't give blood thinner injections in the arms or in the legs. Heparin and Lovenox injections are always given in the abdomen around the umbilicus. Now with any injection, you never aspirate, which means you never pull back on the syringe. So you never aspirate. With all of these, you want to be sure that you are cleaning your skin in a circular motion from inside to out for 10 to 15 seconds. Like you don't want to go side, 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 side. You want to go in to out. You want to go clean to dirty. You want to do a circular motion when you clean. Also with, when you're giving any injection, you want to be sure that the skin looks good. You don't want to give it through a bruise. You don't want to give it through an open area. You want to be sure, or through a rash. If at all possible, you want to give it in a good location of skin where the skin looks really good. You can give through a tattoo if it's a heel tattoo. But you want to be sure that you're checking your landmarks and you're giving it into good tissue and not through a big bruised area or open area. With the difference with a sub-Q and with an IM injection, on an IM injection, you want to hold the skin taut. You want to press down on the subcutaneous tissue, and you want to hold the skin really tight so that your needle goes through easier. And you always go in at a 90-degree angle. On a sub-Q injection, because you want to go into the fatty tissue and not the muscle, depending on how much fatty tissue the patient has, you want to go in at a 45 to a 90-degree angle. If you've got someone that is 100 pounds, then you may have to pinch their abdomen up and go in at a 45-degree angle. If you've got someone that is 200 pounds on their abdomen, you could go in at a 90-degree angle and still hit the subcutaneous tissue. Now, let's talk about the dorsogluteal. This is again the one, it will never be an answer on the test. The dorsogluteal is not even in your books anymore, but you will see nurses give it in this area. And when I went to school, we gave a lot of dorsogluteals. The reason why they don't recommend this anymore is because the sciatic nerve runs down that area. And if you don't know how to measure properly, you can hit that sciatic nerve and do some nerve damage and cause a lot of pain. And some of you may have had an injection before and the nurse not give it correctly, and then you feel a twinge in your foot or a numbing sensation go down your legs. They've probably nicked that sciatic nerve. So let's turn our guy around. Now let's see if I can find an area. I'm going to erase this to show you a little bit easier, because I'm not going to be able to flip these mannequins over to show you the dorsogluteal. So I'm just going to draw a picture. So imagine this is my patient. Yes, this is his buttocks. This is the sciatic nerve. It runs down your leg like that. So we want to be sure that we're giving it in the right spot. So many nurses want to come in, some of you again may have experienced it, where the nurse just gives the shot right in the middle of your buttock. That's not how you do it. You have to feel for the posterior superior iliac spine, which is here, and the greater trochanter, which is your thigh, which is your the top of your femur. I'm going to show you on my lovely drawn buttock here. In order to do it properly, let me make him a little bit of a bigger area. So, to do it on a person, you're going to put your one hand, the palm of your hand, on that posterior superior iliac spine, which again is there. You're going to put your other palm of your hand on the greater trochanter. You're going to put your thumbs together and draw them in. Where your thumbs meet, right there, 2 finger breadths up, is where you would give that injection. Right there. Another way you can measure, to me, I have to feel for the bony prominences. I've been doing this 27 years, and if I give you a shot in the dorsogluteal, I have to fill it out and measure. I do not do it this way, but some nurses do it this way. They make an X, but mentally they draw an X with their mind. And from the center point of that X, they put 2 finger breadths up. And as you can see, it's in the same spot. Now, as we all know, not everyone's buttocks are created equal. So to me, that throws it off a little bit. If you've got somebody with a larger bottom, that doing the X method for me can make it be wrong. So I always like to feel for the bony prominences. So let's look on a mannequin. Okay. So the deltoid on our gentleman here. I'm sorry, this was Miss Lily LaRue earlier. Again, I always have the patient hold their arm like this for me at a 90-degree angle if they can. I don't like it like that because to me it moves the muscle. So if I put it down close to them, to me, I think that's the best way. I'm going to have the patient there. I'm going to feel for the front of their clavicle, that acromion process, and I'm going to make a V with my fingers, and I'm going to go right there. Or I can feel where that top of the bone is, do 3 finger breaths down, and as you can see, it's in the same spot. I encourage you to practice this on your family members at home. Now we're going to do the rectus femoris. Again, it's at the top of the thigh, femoris, the femur. I never know what I'm going to get on these mannequins, so let's. So they have injection sites to the lateralis, but we're going to do the rectus femoris. You feel for the patella. Put your palm there. Your other palm goes at the top of the thigh. Put your fingers together. Where your thumbs meet, you would give it right in the top of the thigh. For the vastus lateralis, again, the side of the knee, your palm on that side of the knee, your palm on the greater trochanter. Put your thumbs together. You would give it to the side. Now the ventrogluteal. Let's see if my mannequin's got one of those. He does. Okay. With the laying down. Now the ventrogluteal to me is the hardest to find. When I tried to even palpate it on myself, to me it just feels like a bone there. Like I don't have enough muscle tissue there to even give a 3 cc injection in. I'm sure that my husband would have a better muscle there than me. So if I had the choice of giving one there on myself, I would have to go for my legs because to me, I don't palpate enough muscle there. So for your patient, so this is his left side, so I'm going to use my right hand to measure. Okay. It's going to be a trick moving him. Lay him on the side. There we go. So here's our patient. Okay. So this is his left side. I'm going to use my right hand. I'm going to put my palm on his greater trochanter. My index finger, I'm going to reach toward the front at the anterior superior iliac crest. My middle finger is going to extend backwards toward the iliac crest. And as you can see, there's my V. I'm going to go right in the middle to give his injection for the ventrogluteal. So again, if you're giving it in the right side, use your left hand. Left side, use your right hand to measure it out. I strongly encourage you to practice this on your loved ones, your children, to see if you have any issues finding it, because for me, that's the hardest one. And that is how you locate the proper area. So pay attention the next time you get an injection. See if the nurse fills out what their landmarks are and make it part of your practice, because it is a good practice.